Hey, Rafi, good to see you, man.
Good
It's
to
been a
see
long
you.
time. This COVID stuff's getting old.
I know. Can't wait to get over it. Well, I'd like to talk to you about inviting some people to join our webinar, the ICJR webinar series on advanced concepts in shoulder surgery. We have a stellar faculty lined up. What are some of the things we're going to talk about, Joe?
I think we're going to talk about shoulder instability, shoulder arthroplasty, fractures, rotator cuff tears. And then I think we're going to air out all our dirty laundry by showing the worst cases of our careers. And not only that, Rafi, I think we have some of the best faculty in the entire world coming for this. So I hope everyone can make it.
Yeah, I couldn't agree with you more. The session, the worst case of my career last year, was a big hit with the audience. Everybody enjoyed it. It's good to know that even the big wigs, sometimes even when you're perfect, things go wrong, and how they handled it. So we thought that'd be an interesting topic to bring back. We also made sure that the talks are very short. They're about 5 or 6 minutes long. Everyone's getting Zoom burnout, and it's going to be in the evening, so we kept the talk shorter, and it's going to be more lively discussion and case presentations.
Rafi, I think it sounds amazing. I'm going to make sure all my colleagues out here on the East Coast show you West Coasters how it's done.
No
So
way.
I hope some people show up in the West Coast.
West Coast is the best coast.
Oh, is that a gang sign?
I'm throwing up signs. Let's go, baby. It's on. The challenge is on.
All right, bring it.
Well, I also think we have one of the most dynamic moderators, Paul Sethi, who's going to lead the rapid fire sessions every week. If you haven't seen him moderate on the podium, he's really good, and he'll make you answer even though you don't feel comfortable if you're a panelist. So if you're a panelist, you better come and be ready for Paul Sethi.
Absolutely. Well, we can't be in Vegas, but it's almost as good.
It's always fun. It's always educational. We have great faculty, great topics, advanced and cutting edge topics that we're going to discuss, like massive cuff tears and all the various treatment options, instability with bone loss and all the different things that you can do for that. Arthroplasty, both anatomic and reverse. So I think it's going to be a great 4-week series.
Yep. And I think we're going to add to it, each faculty member is going to have to be dressed in theme every night. So either tank tops, best jersey, favorite hat. We're going to make it really fun.
That's a great idea. I love it.